Hello, I'm Camille Cloître. I'm an EU project officer at the French HealthData Hub, and I manage the work package on the use cases.
My name is Fynbo Christiansen, and I'm a medical doctor and professor of clinical epidemiology at Aarhus University and Aarhus University Hospital in Denmark.
Having no less than 5 use cases for this project has allowed us to get learnings not only from a variety of countries, but also from different actors, from health data access body to EU agencies to research infrastructure, and also learning from different types of data, so clinical data, socioeconomic data, genomic data, for example. The main learning has been data access request phase is really the biggest challenge, but we managed to get access in no less than 4 of the 5 use cases.
I think the use cases have demonstrated that it's actually possible to obtain data from the different EU member states, and I think it's clear that there are some great possibilities, but also that there are some challenges, there are some barriers, and we need to have legal and technical solutions to remove these barriers. But on the other hand, the use case also stressed that you need to have expertise and knowledge to make this possible.
So I'm Eva Garcia. I'm an IT scientist and project manager from BBMRI, which is the biobanking and biomolecular resources research infrastructure. Our work package has followed very closely the use cases and their issues regarding data quality and interoperability. So what we did was mainly documented how they tackled these issues and also how they approached data security, and this is all for giving insights to other and future projects.
My name is Andrea Ganna, and I'm an associate professor at the University of Helsinki, and I work in health data science. So our use case is about creating an AI model to predict cardiovascular diseases. And to do that, we had to access extensive patient data across 4 countries. In our use case, we are combining data from 4 different countries, and so we need to access nationwide data with a lot of information about diagnostic code, medication, and other information for the entire history of this individual across multiple countries. So the main challenge is actually being able to access this data and convince the data access body that the information we need are useful for our project. And so we are faced both with challenges in accessing the data and data minimization challenges.
The aim of the use case for the European Medicines Agency was to understand how a public health organization like ours can interact with the European health data space. So we've learned about the challenges that we encounter when running pharmacoepidemiology study, mainly the time it takes to access the data, the fact that different authorities require different elements to answer and address our request. But throughout that, also how collaboration and close communication and transparency can enable access to the data and eventually generating evidence that we need to run our mission.
I'm Ionut Sava. I'm working for ECDC. I'm an IT project manager and part of the Digital Transformation Services unit. ECDC use case goal was to demonstrate that HealthData EU infrastructure can be used also for public health surveillance and real world health data, and not only for research. We foresee that the EHDS regulation would bring major benefits such as better integrated surveillance, reduced reporting burdens on the member states, and support in-depth research and cross-border health detection.